Hi everyone, welcome back to my YouTube channel, and today we are going to talk about Norma Frontalis. So let's start our topic with introduction. Norma Frontalis is view of skull as seen from the front or from the anterior aspect. It displays the bone and features that make up the facial skeleton and frontal portion of cranium. This view is important in anatomy, anthropology, and forensic science for studying facial proportions and identifying cranial landmarks. Bones visible from Norma frontalis include frontal bone, nasal bone, zygomatic bone, maxilla, and mandible. Frontal bone forms the forehead, superior orbital margin, and part of nasal bridge. Nasal bone are the pair bones that form the bridge of the nose. Zygomatic bones are also pair bones that form the cheek prominence. Maxilla is also pair bones that form the upper jaw, upper dental arch, and part of orbital margin, and mandible is unpaired bone that form the lower jaw and chin. Major features of Norma frontalis. It has features. We will discuss features on the basis of region of Norma frontalis. So Norma frontalis has forehead region, orbital opening region, nasal aperture region, zygomatic region, maxillary region, and mandibular region. Now let's talk about these regions of Norma frontalis one by one. First region of Norma frontalis is forehead region. It has features there include glabella, superciliary arches, and supraorbital margin. Glabella is smooth midline elevation above the nasal root. Superciliary arches are ridges above the orbit that are more prominent in males. Supraorbital margins are superior rim of orbits that contain a supraorbital notch and foramen. Next region of Norma frontalis is orbital opening. There are two large quadrangular orbital cavities that can be seen from Norma frontalis. Each orbit is bounded superiorly by frontal bone, laterally by zygomatic bone, medially by frontal process of maxilla and part of frontal bone, and inferiorly by the maxilla and zygomatic bone. The next region of norma frontalis is nasal aperture region or anterior nasal opening. It is a pear-shaped opening as you can see in diagram below the nasal bones. It is bounded above by nasal bones, laterally by maxilla, and below by anterior nasal spine that is formed by maxilla. Next region of norma frontalis is zygomatic region. It forms the prominence of cheek and it is formed by zygomatic bone. It forms the lateral orbital margin that formed partially by zygomatic bone. Then the fifth feature of norma frontalis is maxillary region. It contains the upper dental arch with socket for upper teeth. It has infraorbital foramen that can be seen below each orbit. Next region of norma frontalis is mandibular region. It forms the lower jaw and chin. Features here include mental protuberance, mental tubercles, and mental foramen. Mental protuberance is midline projection of the chin. Mental tubercles are small prominences on either side of protuberances, and mental foramen are small opening on each side of nerves and vessels, or for nerves and vessels. Sutures seen from norma frontalis include frontonasal suture, internasal suture, zygomatic-maxillary suture, frontozygomatic suture. Frontonasal suture is present between frontal and nasal bone. Internasal suture is present between two nasal bones. Zygomatic-maxillary suture is present between zygomatic bone and maxilla. And then there is frontozygomatic suture that is present between frontal and zygomatic bone. Clinical significance of norma frontalis. This norma frontalis is useful in forensic identification and determining sex, age, and race. It is also important in plastic surgery and maxillofacial surgery, and it has landmarks like glabella and infraorbital points that are used in craniometric studies. Conclusion of this lecture video. Norma frontalis provides the anterior view of skull showing both the cranial and facial skeletons. It highlights the symmetry and proportion of human face, making it essential in anatomical studies, medical practice, and forensic sciences. And this was all about Norma Frontalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.